Hi, good afternoon. Welcome, everybody. This is Assemblymember Kevin McCarty with our weekly or every other week Facebook Live Town Hall on issues of the day in the Assembly District number 7. My district, of course, covers the greater part of the city of Sacramento, some of unincorporated Sacramento County, as well as the entire city of West Sacramento. So I have about 3/4 of my district is Sac County, 1/4 is Yolo County. But of course, we're all part of the same community here in the greater Sacramento area. And with me today is our guest, Dr. Olivia Casire, and she is the Public Health Officer for the County of Sacramento, who's been in this role for nearly 8 years. And before that, she served in other local governments related to public health in the area. So welcome, Dr. Casire. Can you maybe just introduce yourself and tell us what it is that the public health officer for a county does? What's your job?
Thank you, Assemblymember, for having me on this call. As you mentioned, my name is Dr. Olivia Casire, and I'm the public health officer. So most of the time, the work that we do is in the background. We are there to monitor the health of the community. We get a lot of reports on a daily basis about particular diseases or public health conditions, and we monitor them. In some situations, we take action, such as when there's an outbreak. And we also deal with other issues, working with other members of the community as well as policymakers. But most of the time, when it comes to communicable diseases, we're contacting the different people that are reported to us to find out whether they are getting the appropriate treatment and find out who their contacts are, and also make sure that if there's an outbreak, that we find the source of the outbreak and end the outbreak.
Okay. So how has your life as a public health officer changed in the last 6 months or 4 to 6 months with COVID-19 and coronavirus?
So it's totally different in that our work in communicable disease has just expanded astronomically. The things that we do on a regular basis, we're doing at a much larger scale in terms of issuing orders, in terms of contacting people. So all I'm doing day in, day out is COVID-19 right now.
Yes. And today, of course, we had this scheduled for 10 days or so. And today we did have some news from the governor, and we're kind of going back, frankly, the wrong direction in California with an increased number of COVID-19 positive tests, and we have some more restrictions on some of our public spaces and eateries. The big confusion we'll talk about in a little bit, because it's not for every county, it's 19 counties. So my understanding is Sacramento is one of the counties, but not Yolo County. So before that, we get there, a number of our constituents have sent in concerns and comments regarding this phase 3 of the reopening. And my question to you is, when did Sacramento County actually move into phase 3? And what are the sectors of the economy that are part of this phase 3?
So, just to give a little bit of a background, when this COVID 19 started and we were seeing cases being reported to us very rapidly, the whole state moved to issue the order of stay at home for entire communities. And we put that in place so that we could reduce the infections that were occurring. And I'm sure this is a term that a lot of people have heard, bend the curve. And we did that pretty successfully. And so by the end of April, our case count had come down. Our daily case count was about only 10 cases a day, down from at the peak in early April, which was about 50 cases a day. And so at that point, the state allowed us to start the process of reopening, and the state is doing that in phases. So stage one was when everything on only essential services were allowed to operate. And then stage two, or those services that were deemed to be at minimum risk in terms of infection, and those are things where it was easy to maintain the 6 feet separation. So we were allowed to start working on those, and we opened up several business sectors. And then a few weeks ago, we were allowed to start looking at business sectors that were considered more at risk because it was sectors where there were opportunities for people from different households to gather, and where it might be a bit of a challenge with the social distancing, where modifications had to be made. So those included some of the sectors like family entertainment, gyms, hair
Mm-hmm.
salons, in house dining, and so we were able to move into those. Unfortunately, what has happened as we started moving into the different sectors is that the increase in cases increased rapidly, especially the last 2 weeks. And Sacramento County is one of those counties that made it on the watch list, where the state is looking at a certain set of factors, and due to our increase in hospitalizations and our reduction in hospital bed capacity, we made it on that list.
Yeah. So let's talk about that for a bit. Some may be very knowledgeable about this. Some have just basic information. So when we talk about flattening the curve, it's of course one of the things we want to do is to put to relieve the pressure on our healthcare system and the hospitalizations. So Sacramento County is on this monitoring list because they're concerned about increase, um, basically people going and increase people checking into our hospital system and in the ICU. What does that actually mean? Why is that a treacherous thing to have so close to uh, capacity at our hospital system? What would that mean if it continued?
So there are a couple of things that we're concerned about. One is that if folks recall, there was a time when we were having a number of outbreaks in long-term care facilities, and as we know, the elderly are one of the groups that is at highest risk of severe disease and death. And we worked really hard to control those outbreaks through the measures that we put in place with the stay-at-home and restrictions to visits, and also closing some of the businesses. Um, and now that we got to the point where that was controlled, as we're seeing more cases and more infection occurring in the community, there is the risk to those vulnerable communities as more infections occur. So there is the risk to the long-term care facilities, which is a vulnerable group. And then for even people who are not in those long-term care facilities, if they have certain diseases such as diabetes, hypertension, and other chronic diseases, they can have very severe infections and end up in the hospitals or intensive care units. The problem with having a lot of people in the intensive care units is that it does put a strain on our hospital system, and the concern is not being able to have enough beds for not just the COVID patients, but we have to remember that there are still other needs in the community. So we want to be sure that if somebody was, for example, to be involved in an accident, or to if someone ended up in the emergency room with a stroke, that there would be enough resources to adequately take care of that person. So one of the things that we are monitoring very carefully is our ability to be able to provide the appropriate care for the patients that require it and need it.
Mhm. So today, I'm sure most people know this already, but the governor announced at noon today that there are 19 counties that are on this monitoring list. They've been ordered to close the following indoor sectors for the next 3 weeks. And 19 counties, the county that's but of course, Sacramento County is on that, but not YOLO. And so some of the things that must be closed are restaurants, wineries, tasting rooms, movie theaters, family entertainment centers, zoos, museums, card rooms. Uh, what do we know as far as can any of these businesses stay open if they move their operations outdoors? I saw today driving through Midtown, some of the Midtown restaurants have taken up and removed their street parking and put the sidewalk essentially into the parking area and put like a barricade up and put tables up on the sidewalk. So can restaurants do this and remain open if they have their operations outside?
So one of the things that we know about the COVID-19 is that activities outside in the open air, and especially with the sun, these settings tend to reduce the risk. And so, as the governor told us to go ahead with closing some of these sectors, there was the provision that if they are able to provide services either as a pickup or if they're able to provide them outside, that they can go ahead and do that. And actually, as we were opening up with the restaurants, that's one of the things that we were allowing them to do earlier on before we allowed for dine in. So as we are scaling back, we're going back to that where people can either pick up the food or they can dine outside.
Yeah. So I saw something yesterday online which talked about that the particulates that leave your mouth if an individual coughs. It says if you cough with no mask on, typically it goes 6 to 8 feet. If you cough with just a bandana on, the spread is 3 feet. If you have a proper mask or a hospital mask, it's a matter of inches, and so that's why masks are important. So, can you talk about why it matters? Why are we so fixated on indoor activity, and why are indoor activities such as gyms and bars and restaurants so dangerous as far as a public health perspective?
So some settings indoors, especially in places like bars, it's much more difficult to maintain the 6 feet of separation. And also, as people are drinking or eating, they cannot maintain a face covering. And so, those are settings that can easily lead to a higher risk of infection. The risk, of course, also is that now we know that this virus can be passed on by people who are not exhibiting symptoms. So people might feel fine, and we've heard this over and over again as we've been doing our contact tracing. They go out as a group to enjoy the evening, and then a few days after that, some of them start exhibiting symptoms, and some actually end up with very severe disease. And we find that it leads back to some of these settings. So indoors, because of the air circulation. Secondly, it's being able to maintain the 6 feet of separation. And then for some of these activities where it would be difficult to wear a face covering, it increases the risk of the infection being spread.
Okay. And just for people on online here, you can write your questions to us. And someone just mentioned here that our audio is breaking up and is the visual as well. So that's news to me. So I'll see what we can do about that. So we're going to go forward with some of the questions that were sent to us earlier, as well as some that are presented to us today. The first question is with this new mitigation in Sacramento County for bars and other entities, what are the additional steps that may be needed if this doesn't work and decrease the number of COVID-19 positive tests?
I think what's important for all of us to realize is that we all have a part to play, and being able to remember some of the things that we're all being asked to do, which is using the face covering when you're going outside of your home, remembering the social distancing as much as possible. And the hand washing is also important. And for those who are having symptoms, however mild your symptoms are, to remember to stay home and get testing if those symptoms continue to occur. So those are all important messages that we're trying to put out. The other is also avoiding gatherings, because in our contact investigation, what we have heard over and over again is that oftentimes these infections and the spread is occurring when people are getting together for family gatherings, for birthday parties, for graduation parties, for funerals. And so, just a reminder that we still have COVID 19 in the community and we need to avoid these gatherings.
Okay, let's start asking some of the questions over here that people have asked us about today. Jay Perez says he has a friend who's a nurse in Stockton and their hospital capacity is at 100%. How are we doing in Sacramento? What's our hospital capacity right now?
Hospital capacity, that number is is not static, because one of the things that our hospitals, and we do meet with them on a regular basis, is that it, for example, for the intensive care units, it might show that it's at 13%, but that's without their surge capacity. So yes, we do look at those numbers, but what's more important also is the number of surge capacity beds. And so, for example, for Sacramento County, we know that we have about 800 beds still available for surge capacity.
Okay. We have someone asked about parks and being outdoors, and our understanding is that the mask requirement in Sacramento County is not for outdoor activity. And can you talk about being outdoors, whether or not it's safe for kids to play outside, and what we should do when doing stuff outdoors?
So even for activities outdoors, it's still important to maintain the 6 feet of separation. And also for certain activities, you still need to have the face covering. So those are important things to remember even as people go to enjoy the parks outside.
Sorry, I'm trying to make sure I increase my Wi-Fi speed here to make sure people can hear us. So I had to hop out real quick. Somebody asked about casinos. Why are casinos allowed to operate and not part of the rules here in Sacramento?
So the decision for the casinos was made at the state level, and it pertains to some of the rules that govern some of the casinos that are on the reservations.
Yes, and then of course card clubs are not, which is why the order the other day made sure that we focused on closing card clubs here in Sacramento. What are the next phases of if these numbers don't get better? What would it look like as far as going back? Would we have going back to phase 1 or phase 2 of shelter in place? What would that look like if we don't see a stabilization or a decrease in positive testing and hospitalization rate?
So we're certainly hoping that the measures that we are taking will be effective. It'll take at least 2 or 3 weeks for us to see if there is an impact. So in that time, we're going to be continuing with the monitoring and continuing with the messaging. If not, we are going to look at what the numbers are telling us in terms of who is getting infected, who is getting impacted, and make decisions based on that. If we're finding that certain businesses are creating an avenue for the infections, then we will look at that as well. But it will be driven by what we're seeing with our contact tracing.
Okay, so let's actually, that's a question here. Let's talk about what does that mean, contact tracing? And first of all, maybe go back and talk about what is contact tracing meant for the past decade or decades in our state and our community.
So there are certain activities that we are involved in public health when we get a report of a communicable disease. So contact investigation and contact tracing are terms that might be new to a lot of people, but those are actually strategies that we use for a lot of other communicable diseases, and we use them all the time. As far as it goes for COVID-19, basically what it means is when a case is reported to us, because by law, every positive case needs to be reported either both by the lab and by the medical provider. And when public health gets that report, we have a team of individuals, including nurses, who will then take those names, call the individuals, and find out some information about them, where they live, where they work, who else is in the household, and what kind of activities they were involved in, so that we can find out where the exposure may have occurred. And then we also get the contact information for the others. For example, if it was at a party, who else was at that party? And then go ahead and contact those individuals as well. The importance of this is, one, it does provide us with information as to what is happening and where the infections or the spreading is occurring. And the other important thing is that when we reach out to those contacts, we can provide them with information about either going to get tested themselves, or going on quarantine, or also finding out if they have symptoms as well. So this is a strategy for us to be able to slow the spread of the disease.
Okay. And by the way, people, I guess my video feed is coming in and out, but my voice is still there. So I'll keep. So you're good the whole time. So even if you don't see me, I'll keep asking the questions. There's another good question here from George Riot. He said, of course, today we heard from the governor. He talked about ramping up enforcement. We've heard from sheriffs around the state. They're not going to cite people, and it's hard to enforce the mask requirements. What's your perspective on that? What should a local government do when we're trying to focus on saving lives and public health, do to try to not just encourage, incentivize, but make people wear masks? What can be done or what should be done by a government?
So one is providing the education, and one of the ways we do that is providing you with the numbers so that you know what is going on in the community. We also do interviews with the media, and the media is able to get information out about what we're seeing and what the message is for protecting ourselves. The other that we can use is with the businesses, and many of the businesses have put in measures. We ask them to develop protocols that they follow for being able to reopen, and those include the social distancing as well as the face covering. And so in that way, we're able to, for people who may need some encouragement to follow the protocols, the business is a good way of doing that, because, for example, in some businesses, they'll tell you that you will not be allowed in if you are not doing the social distancing and the face covering.
Mm-hmm. So let's go back to the contact tracers. This is another question, right, where when you finish that, and I didn't quite hear this. What does that mean as far as how many people are currently employed by the county or state government or others doing this contact tracing in our region, in Sacramento County?
So with COVID-19, we have had to expand the number of people that we have working in that section. And when we started doing the contact tracing, we started off with 30 people. So we had individuals from public health who were on their regular day doing working in another program, but we pulled them in to be able to assist with this. We also got help from other departments within the county that loaned us some of their staff. We're also working with volunteers. They have been a strong part of our workforce in being able to deal with COVID-19. As we move forward, we are also looking at working with other partners, such as some community-based agencies, to be able to have them hire additional people that will be able to do the contact tracing in the communities. So we're doing this in phases and training people as we go along. We are at 60 people right now that are doing this work. And of course, as you can tell, with getting over 150 cases per day, that's a lot of work for those 60. So we have plans to continue to recruit more people to assist us.
Mm-hmm. Okay, here's and I'm just gonna just tell folks you can keep typing your questions on the right. We'll try to get to a lot of them, and I have some that were sent earlier, and we may be bouncing around topics, but we'll try to make sure we address all these issues in an organized manner. I want to talk about now that people are who are being tested in the who have been tested positive for COVID-19 here locally and across the country. A rising number of younger people from 18 to 49. And so one, what do you attribute that to? And then two, it seems that people who are testing positive for this are less likely to be hospitalized or end up in ICU and frankly die. So the good news is that younger people who are getting it don't have many times underlying health conditions. And so that's having some impact on the healthcare system, but still it creates challenges. So what do you attribute to the large number of young people testing positive for COVID-19?
So, as you have said, there was a time when this whole outbreak started, where a large percentage of the people that that were being reported to us were those in the age group over 60. And as time went on with the stay-at-home order and everyone staying at home, and our numbers went down, that number reduced as we were getting control of the outbreaks that were occurring in long-term care facilities. What has happened as we've opened up with the businesses is that the young adults, as you've mentioned, 18 to 49, we're seeing more cases in that group, and now about 50% of the cases we're receiving are in that age group. And part of that is because these are the people who tend to get around more, they travel more. They're the ones who are working. So as we are opening up additional business sectors, they're the ones who would be going out to the different places. And as movement increases, then the risk and chances of the spread of infection occur as well. So I think that's a big factor. The other is also that as we were opening up and as the message came across that we have been successful in bending the curve, there was the sense from a lot of people that the danger has passed. And so you found people who had stayed at home and cooped up for 2 months were very anxious to meet with their friends and extended family. And so we were hearing about birthday parties, graduation parties, and so on. And these gatherings, we are finding where a lot of the spread of infection was occurring.
And are those indoor events?
Many of these were indoor settings. And of course, with indoor settings, the risk is much higher because of the difficulty with maintaining the 6 feet separation as well as the face coverings. Because for many of these gatherings, they were gathering to share food and laugh and talk together. So a lot of opportunities for the virus to actually spread.
Okay. Let's go now to testing, vaccines, and treatment. First, let's talk about testing and what's the status of the availability of testing for people in Sacramento County?
So with testing, we've actually made quite a bit of progress. As you recall, when this whole started at the beginning, There was a time when the public health lab was the only one that was able to do the testing, and we were only able to do about 20 tests a day. So we were focusing only on people with severe disease who are hospitalized. As time went on, and the commercial labs as well as the hospitals were able to do the testing, the number of tests has gone up to the point that now we're able to do anywhere from 1,500 to 2,000 tests a day. One of the questions that been asked a lot is, could it be that the increased number of positives we're seeing is because of the increased availability of testing? And yes, there is more testing available, but what is important, the number that is important to look at is the positivity, and we have seen that increase. There was a time when our positive rate was about only 1%, and that has gone up with time. On average, over time, it's been about 3%, but within the last week, it's actually gone up to 5%. So there's definitely more infection occurring in the community. As far as availability, we still do have a drive-through site where we do about 300 to 400 tests a day. And then we also, the county has set up additional sites in 5 communities where we felt that there was an additional need. These were disadvantaged communities, so being able to provide more testing in those communities as well. And then the hospitals and many of the clinics are able to provide testing as well.
Okay. I have a question here about the reliability of these tests. Joel asks, can you speak about the reliability of the nasal swab test as well as the antibody test?
So the nasal swab, the technique itself, it's really important to make sure that the technique is done right, because if the swab is not done right, then you will get a lot of false negatives. So we spend time training our staff to be able to make sure that they get the technique appropriately. Then in the lab, there are several tests that could be used. We use a PCR test that was approved by the Centers for Disease Control. It is very reliable, over 90%. So that's the best test that is available. There are some other tests that have been produced over time that may not be as reliable, but our state website uh, provides information about some of those. So it's really important to make sure that you're going to a place where you'll get a reliable test. We've heard reports about individuals who had heard about tests that you could do in home as an in-home kit, but those are not approved, and we don't encourage people to use those at-home kits at this time because they're not reliable. Then there are also some rapid tests that are used in some of the hospital settings, but those also do have a propensity much higher to sometimes give false negative or false positive results. So they are good in certain settings when you need to have a result very quickly, but they're not the most reliable. The other test that we've been asked a lot about is the blood test that tests for antibodies, which is different. And right now, we in public health, we do not offer that test. We do not use it because it is that the results cannot be used to make decisions, and we're not sure how to interpret those results as yet. So those antibody tests are available, but we are not using them.
Mhm. I want to ask now about the need to take a test more than once. So when I went back to work at the Capitol a few months ago, I got tested. That was the requirement for all lawmakers. This must have been 2 months now, and I got the nasal swab test, and it wasn't pleasant, but got the results back in a couple of days from UC Davis, and it was it was effective and it was needed. So under what circumstances do people need to get tested on a regular basis? Some jobs you get tested, more than others. So what should the public know about getting tested more than once or multiple times?
So right now, the only group where there's a recommendation for regular testing is with those in the long-term care facilities, and that's because of the congregate setting and also because it's a vulnerable uh, group of people. But otherwise, for everybody else, the most important thing is to do the symptom checks on a daily basis and also the temperature checks. And then if you have been informed that you're exposed, or if you're starting to exhibit symptoms at that point, it is advisable to get tested as well.
Okay. Can we go now to where we're at with the vaccine? And what's your estimate as far as when we will have an available and effective vaccine for COVID-19?
So what we have been told by the Centers for Disease Control is that there are several vaccines that are being worked on right now. They're still in the testing phase. Our hope, of course, is that we will have something by the end of this year, but of course it's very dependent on the scientists. So I don't have a definitive timeline at this time, but we're told that it could take anywhere from a year to 18 months to be able to have a vaccine that's available.
Okay. How about treatments? How are we progressing with treatments? And do you expect to see more readily available and effective treatments later in this year as well?
So one of the things that has happened over time, especially with the last couple of weeks, in fact, the last month or so, is that the state was able to get an allocation of a drug called remdesivir. This is an antiviral drug that has been approved for treatment for COVID-19. And through that allocation, we were able to distribute it to our hospitals, and they have been using it very readily, especially with this recent increase in cases. We also know that there is a plan or a contract that is being worked through where the state will be able to continue being able to provide that to the hospitals. So being able to have that antiviral is important because it does help. And the doctors, the infectious disease doctors, tell us that they are learning more and more about different ways that they can treat and different medication that they can use for being able to treat the COVID-19. So my sense is that we are much better off than when we started, but definitely there's a lot more that we need to learn. And definitely also because the COVID-19 spreads so quickly, we still have the best way for us to be able to deal with this is the prevention measures. And we've gone over those again and again and again, which is the face covering and the 6 feet of separation.
Mm-hmm. I went to the Capitol today and I saw people were walking in and visitors had to get their temperature checked at the door. And that's in some establishments, and we're talking about potentially that when people go back to school. Question here is, Kelly asked, what are the most reliable ways to take your temperature?
There are a number of thermometers out there that could be used, and especially if they're going to be used in a setting like a workplace, the no-touch thermometers are the best because you want to be able to make sure that you minimize the amount of the number of people that touch that thermometer. But there are a number that are available that are reliable.
Yeah. Okay, I want to get to another section here. We have questions on, I call it COVID-19 facts, fiction, and responses. We mentioned earlier as far as what are the most common ways how people have become impacted by COVID-19, and we talked about airborne. What are we learning now as far as people getting it from touching doorknobs and grocery carts? Um, so the whole fixation on hand sanitizing versus breathing. It seems that that's more of the focus now. I wonder if you can tell us from a medical perspective and a public health perspective.
So the most important and the majority of the spread is through the air. So it's respiratory, and that's why there's the focus on the 6 feet of separation and the face covering. But we also know when people touch, for example, touch their mouth, they might get virus on their mouth. And then if they touch other surfaces, then there is the possibility that if someone else touches that surface, that they could then get the virus on their hands and then transfer it to their mouth or their nose that way. So that's why it's important to also emphasize the hand washing and hand sanitizing and also cleaning surfaces that are touched frequently by different people.
But the most important thing to do is to wear a protective mask, because the majority of the impact is from the droplets from breathing and so forth.
That's correct, yes.
Yeah, which is why I've been a little bit apprehensive about going back to my indoor gym. What do you think about gyms and the indoor activity?
The gyms were given a protocol and guidance that they should follow for being able to, one, limit the number of people within the gym so that they can be able to maintain the 6 feet of separation. Secondly, also, we are going to make some changes. Before, there were some exemptions for people with doing certain activities, not requiring them to wear face coverings. That is going to be changed so that you need to maintain your face covering the entire time that you are in the gym. And if there are activities that will make it difficult for you to use the face covering, then at that time you should choose not to engage in those activities. The other thing that the gyms do is frequent cleaning of all of the surfaces. And probably if you have been to a gym, you've probably seen all the signs around about the hand washing and cleaning, and also preventing people from crowding in different places or using common equipment, or at least making sure that equipment is cleaned before in between the different people using it.
Yeah. So can you clarify that? So I'm thinking about like a gym. There's people working out with exercise equipment on their own, lifting weights and so forth. And then sometimes in the gym you have classes, the spin classes on the bike, the CrossFit classes, the boot camp classes. So those are the ones that you would be concerned about, and that it's hard to have a mask on and do those classes. So would those classes actually be shut down?
The gyms will have to reconsider all of that because we are going to change the requirement that face covering will have to be used indoors.
Mm-hmm. Gotcha. I want to ask now about herd immunity, and if you could explain, what does that mean? What does herd immunity mean?
So herd immunity is a term that we use in public health, which basically means that as more people uh, develop immunity to a certain disease, it makes it more difficult for that disease, or that if it's a virus, that for that virus to be transmitted from one person to another. Um, Usually, in order to get to that level of herd immunity, a large percentage of that population has to have the immunity. And usually, for example, if you're looking at measles, for example, that you would need about over 90% of the population being immune. The way to get to that, getting immunity, there are two ways. One is through a vaccine, and the other is through people actually getting the disease. In many of the cases for communicable diseases, having everybody get the disease can have devastating consequences because in many people, having the disease can lead to death or can lead to very severe disease. So I know that for COVID-19, that's a question that some people have asked, that why don't we just let everybody get it and then we'll get to herd immunity. But there's a number of factors that would cause problems for that. One is that in order to get to that, in order to get to 90% of people having had the disease, that means that you have a large percentage of people that could get very severe disease and could die. So the consequences of that can be very devastating. And if we look at our population, where we have minimum a third of the people with chronic diseases like diabetes and hypertension, that's a large percentage of the population that would be at risk. And on top of that, if you add those that are over the age of 65, I think those are unacceptable numbers of risks for people that would have severe disease. So that's why we're going through all of this trouble of trying to prevent the spread. We know it's very inconvenient for people. We know it causes a lot of difficulty to have to stay home or wear a face covering. But this is where the community comes in and where each of us has a role to play in keeping the community safe. Because if you prevent the disease from spreading from one person to the other, then you are actually protecting those that are vulnerable.
Mhm. I want to ask now about COVID-19 and the weather. When COVID-19 and coronavirus, first, struck our nation, we started talking about this. It was in the middle of winter, approaching spring, the cold months, and there was a notion that when it got warmer, that it would get better, that the virus would die off, especially if it's on surfaces. And we haven't seen that. And frankly, we've had some of the worst hospitalization rates and positive test rates in our country now when it's over 100 degrees. So what's the notion? How have things changed? And then how does that lead us to think how this is going to play out when we get back to the cold months?
So what we know right now is that the infections and the rates are being driven by behavior. If you recall, when we had the shutdowns and the stay-at-home orders, the rates did go down because people were staying home, and so the risk of infection was lowered. But as people are moving out, as these gatherings do occur, and the infection is increasing, we're seeing the rates go up. So it's mainly being driven by behavior at this point. We have not seen any variation as a result of the weather or the seasons changing.
Mm-hmm. Okay, we have about 10 minutes left, so let's get to some questions on reopening California. So when we started this, it was 3 or 4 days ago, we started getting the questions in. Things have changed. So of course, today is the 1st of July. We have the 4th of July coming up as people think about celebrating America's birthday in the next few days. What should we be telling people? We know we're not going to being able to go to baseball games and the River Cats here in Sacramento. Fireworks shows have been canceled at Cal Expo. But historically, 4th of July has been about small gatherings in people's backyards. And what should we tell people about that? Can they have people over in their backyards if they socially distance, keep 6 feet away, wear masks, stay outside? What should we tell people in our community?
I think first and foremost is if you have any symptoms at all, please stay home. The second is we ask that you do avoid these gatherings. I know it is hard because this is a holiday, but if you think of the bigger picture, as we are trying to get through this together, I think the most important thing is to see what you can do to prevent the spread of disease. So staying home and staying away from gatherings are important. For those who do end up going out, because we know that probably some people will, there are other things that you need to remember. One is the social distancing, two is the hand washing, three, using the face covering, and being outside and not sharing food. All of these are factors that people need to remember in order to remain safe, because I think it will be very difficult for us, knowing what the numbers are looking like now, if there is an even greater increase in infections as a result of people going out and having these gatherings during the 4th of July celebration.
Yeah. Um, I've had a few questions here on schools and education, and that I think is a larger issue. And just to note that we're going to have one of these Facebook Live town halls in a couple of weeks with the superintendent from YOLO from West Sac, the district there, Washington, as well as our Sacramento County superintendent of schools, Dave Corden. So we'll be touching on that and what happens with our schools. But I did note that yesterday a report came out that said that America's pediatricians are saying that kids should go back to school with all the downsides of anxiety staying at home and isolation, and kids need socialization, and having the long-term impacts of kids staying away from school. Our teachers and our public health officials may be pausing. So how do we bridge that issue?
Thank you. And we've been working very closely with our superintendents in Sacramento to come up with some guidance that they can use in order to make decisions on what process they will go through for being able to have children return to school. I think what's important, yes, it's very important. We know that school is important, and we want to be able to get to the point where we can have our students back in school, but we also want to do it safely, because if we open the schools and don't have measures in place to protect our children, then if there is an outbreak in a school, then we would be right back to square one, where we have to consider closing schools. So when we open them, we want to make sure that we have measures in place to keep our students safe, and that's what we're working on with our superintendents and principals.
Okay, this is an interesting question from Debbie here. She says, if masks are going to help prevent the spread, then why do the physical distancing? If the physical distancing works, then why wear masks?
It's not an either or, because none of them is foolproof, and that's why it's most important for us to use all of the measures that we have talked about. Um, Doing the temperature checks, the symptom checks, staying home when if you're sick, and then when you go out, these are all things that you need to remember, because each of them helps. It's not one replacing the other, but together they actually provide the best protection.
Okay. I think that wraps up the majority of the questions and the themes that we had here. I couldn't get to them all, but I tried to group them all. What parting comments do you have that you could share with us as far as what's next, our patients, and how we can get through all this?
We do recognize how hard it is for everybody with having to stay home and then having to make changes. Uh, and but I think it's important to realize the bigger picture. One is that if we can all work together and implement these measures, and we get to the point where, and we've done it, we were successful when we actually got to the point where we were getting only 10 cases per day, then we can actually start reopening and being able to see some level of normalcy. It will be different, because we will still need to look at the 6 feet of separation and the face coverings. Those, I think, for the foreseeable future will be a part of our lives until we're able to get to the point where we have complete and total control of COVID-19. But while it is still here, I think it's important for everybody to realize that each of you and the actions that you take are important in being able to protect the community.
Yeah. And then lastly, I just wanted to share with my constituents what I'm working on at the state level as your legislator on this. And I see we had one question here, a few questions about schools. I see Edmund Exley. I don't think he's the same Edmund Exley from LA Confidential, but probably just uses that name. Asked about schools and kids, how do people go back to work? We passed the budget just a few days ago, and my theme was, in order to get California back to work and people going back to work, we need to take a look at our education system and our childcare system, because we have 6 million kids in California and a couple 100,000 more in our childcare programs, and those families are all counting on that to go back to work. And so, which is why we adopted a budget that did not cut any of those, but it leads to some serious questions as far as how do those things operate in the COVID-19 era. What does that mean? What does a preschool and a child care center, family child care home look like? How do you get masks on kids? How do you keep them from physical, how do you focus on physical distancing with those kids? Do you have programs at school where kids come some days to school and some days you do remote education? What happens on those days where the parents in work? So there are a number of complications here that we need to sort out. But the premise that I thought was most important is you can't do more with less money. So when we passed our budget this past week, we made sure that we had zero cuts to our school system, and we're utilizing federal money, money from our reserve or one-time money to prop up our education and childcare centers to make sure that they are working. Because in order to get our state back going again, it's such a link to make sure it works. So that's going to be the topic of our next legislative town hall on COVID-19 on Facebook here. But again, these are complicated times. Even I, as your assembly member, have way more questions than answers. And so we're, going through this sometimes week by week and day by day. But I think, what the governor laid out today is appropriate. The stats speak for themselves as far as the increased number of people showing up at our hospitals and our ICU beds. We need to make sure that we flatten the curve. We did it once before. We reopened a little bit. Whether or not we reopened too fast I'm not going to second guess at this point. I know people in our state were dying to get back at it, and so we realize now that we need to be a little bit more responsible and kind of dial it back a bit. So I think what the governor has proposed today, it makes sense. I encourage people to respect the premise too. So I know we have this with this new order in Sacramento, but not in Yolo County. So I would think it would be irresponsible for all of Sacramento to drive to Yolo County to have dinner tonight and tomorrow night, 4th of July, because it's the same issue basically in this region. So with that, we'll get through this together. And thank you all for engaging, and thank you to our public health official here, Dr. Olivia Casirier, for showing up today and educating us on this issue of such importance in Sacramento, West Sacramento, and California. So with that, thank you. This will be on our Facebook page. You can forward this or share it or go back and look at it if you want to see any of the answers from our public health official for Sacramento. So thank you so much, and we'll see you soon.
Thank you.